Hello and welcome. Let's get right to it. Have you ever taken Tadalafil expecting a certain result only to be left feeling disappointed and frustrated? If so, I want you to know you are definitely not alone. It's a common experience, but the solution might be much simpler than you think. In fact, studies show that up to 30% of men who believe Tadalafil isn't working for them are, in reality, just not taking it correctly. When these simple mistakes are corrected, up to 69% of those same men start seeing the positive results they were looking for. You might be making a few simple errors that are preventing you from getting the full benefit of the medication. This can lead to wasted time, wasted money, and a lot of unnecessary frustration. In this video, we're going to break down the most common mistakes people make when taking Tadalafil. My goal is to provide a clear, practical guide so you can learn the right way to use it, maximize its effectiveness, and regain your confidence. As a healthcare professional specializing in men's health, I've seen firsthand how a little bit of knowledge can make a world of difference. First, it's important to understand what Tadalafil is and how it works. Tadalafil belongs to a class of drugs called PDE5 inhibitors. In simple terms, it's a vasodilator. That means it works by relaxing and widening your blood vessels, which allows more blood to flow to certain parts of your body, including the penis. This increased blood flow is what makes it easier to get and maintain an erection. Now, Tadalafil is unique because it comes in two main dosing schedules, and it's crucial to know which one you're using. The first is on-demand use. This is typically a higher dose, like 10 milligrams or 20 milligrams, that you take only when you anticipate sexual activity. The second is daily use. This is a much lower dose, usually 2.5 milligrams or 5 milligrams, that you take every single day at the same time. The goal here isn't an immediate effect, but to maintain a constant, steady level of the medication in your system. This makes you ready for sexual activity at any time without having to plan ahead, and it also works as a longer-term treatment to improve overall vascular function. Understanding which approach you're on is the first step. Now, let's dive into the 5 most common mistakes that could be sabotaging your results. Mistake number 1, not waiting long enough for it to work. This is by far the most frequent issue I encounter. Many people take Tadalafil and expect it to work like a painkiller within 10 or 15 minutes. That is not how it works. Tadalafil needs time to be absorbed into your bloodstream and start working on your blood vessels. For the on-demand dose, you need to take it at least 60 minutes before you plan to be sexually active. Even then, the medication typically reaches its peak effectiveness around 2 to 3 hours after you take it. So, if you take a pill and immediately try to initiate intimacy 20 minutes later, you are setting yourself up for disappointment because the medication hasn't had nearly enough time to work. The solution is simple. Plan ahead. Give the medication the time it needs. Taking it 1 to 2 hours beforehand is an ideal window. Mistake number 2, taking it with a heavy, fatty meal. What you eat matters. If you have a large, greasy meal, like a cheeseburger with fries or a big steak dinner, and then take your Tadalafil, the fat in the food can significantly slow down the absorption of the medication from your stomach into your bloodstream. This doesn't mean it won't work at all, but it will delay the onset of action and can even reduce its overall effectiveness. You might find that it takes much longer to kick in, or that the effect is weaker than you expected. The solution here is to take Tadalafil on an empty stomach or with a light, low-fat meal. This allows for the fastest and most efficient absorption, ensuring you get the full effect when you need it. Mistake number 3, assuming it works without any sexual stimulation. This is a huge misconception. Tadalafil is not a magic pill or an aphrodisiac that will automatically give you an erection. It is a facilitator, not an initiator. Think of it this way. The medication gets your body's systems ready, improving blood flow and preparing the plumbing, so to speak. But for an erection to actually happen, your brain still needs to send the right signals. That requires sexual stimulation, whether it's visual, physical touch, or mental arousal. If you take the pill and then just sit on the couch watching the news, waiting for something to happen, nothing will. The medication works in response to arousal. The solution is to engage in foreplay and create a situation where natural arousal can occur. The tadalafil will then be there to ensure your body can respond physically to that arousal. Mistake number 4, being in a state of high stress or anxiety. Your mental state is incredibly powerful and has a direct physical impact on your body. When you're stressed, anxious, or worried about your performance, your body releases a neurotransmitter called adrenaline. Adrenaline is the fight or flight hormone. It's designed to prepare your body for danger by tightening blood vessels and redirecting blood to your muscles and vital organs. This is the exact opposite of what tadalafil is trying to do. Tadalafil is a vasodilator. It widens blood vessels. Adrenaline is a vasoconstrictor. It narrows them. If your body is flooded with adrenaline due to stress, it can completely override the effects of the tadalafil. You can take the pill perfectly, but if your mind is racing with anxiety, your body's own chemistry will work against it. The solution is to prioritize a relaxed and comfortable environment. Minimize pressure and focus on connection and intimacy, not just performance. If performance anxiety is a persistent issue, it's something worth discussing with a doctor or therapist. And mistake number 5, for those on the daily dose, giving up too soon. The daily 5 mg dose is a treatment, not a one-time fix. It works by gradually building up in your system to improve blood flow over time. It is not designed to have a powerful, immediate effect like the 20 mg dose. Some men start the daily regimen, don't see a dramatic change in a few days, and conclude it's not working. They then stop taking it. However, it can take up to 3 or 4 weeks of consistent, daily use to experience the full benefits of this treatment approach. The solution is patience and consistency. If you are prescribed the daily dose, you must commit to taking it every single day at the same time for at least a month before you can truly evaluate its effectiveness. Now that we've covered the main mistakes, let's quickly go over a few other crucial factors. First, alcohol. While a single glass of wine is unlikely to cause a problem, excessive alcohol consumption is a bad idea when taking tadalafil. Alcohol is a depressant of the central nervous system, which can inhibit the brain signals needed for an erection. It can also interfere with the medication's absorption and worsen side effects like dizziness. In short, alcohol is a saboteur to the effects of tadalafil. Second is the quality of the medication itself. Not all tadalafil is created equal. The quality of the raw materials, the manufacturing process, and the bioavailability can vary between the brand name drug and different generic versions. While many generics are excellent, some from less reputable labs may not have the same potency. If you're using a generic and not getting results, it may be worth discussing with your doctor about trying the brand name version or a generic from a highly trusted laboratory to see if it makes a difference. Finally, what if you're doing everything right and it's still not working? In that case, it's time to have a serious conversation with your urologist. Failure to respond to tadalafil could be a sign of a more significant underlying health issue. Erectile dysfunction is often one of the earliest symptoms of cardiovascular disease. It could also be related to hormonal deficiencies, metabolic disorders like diabetes, or nerve damage. Your doctor will need to do a more thorough investigation to find the root cause. Don't just assume the medication has failed. Use it as a signal to look deeper into your overall health. And while exploring these options with your doctor is essential, I feel it's important to share something truly groundbreaking that many men are turning to, especially if they're looking for a solution beyond conventional pills. It's a different approach, a bizarrely simple, 100% natural home remedy that addresses the real root cause of male performance problems. It takes just 7 seconds to do, and it's designed to help restore the powerful, automatic, rock-hard erections you had in your youth without any lifestyle changes. For those of you who want to see this eye-opening discovery for yourselves, a QR code is appearing on your screen right now. Just open your phone's camera and point it at the code to watch this short, powerful video. If you're on a device where you can't scan the code, don't worry. The first link in the pinned comment below will take you to the same place. Now, let's wrap up with the key takeaways from today's video on tadalafil. So, to recap, let's go over the key takeaways for taking tadalafil the right way. Time it correctly. Take it at least 60 minutes before intimacy. Watch your diet. Take it on an empty stomach or with a light meal. Remember stimulation. It only works when you are sexually aroused. Relax, manage stress and anxiety, as they can cancel out the drug's effects. Be patient. If you're on a daily dose, give it several weeks to work. By avoiding these common mistakes, you can dramatically increase your chances of success with Tadalafil. It's a highly effective medication when used properly. Most importantly, this information is for educational purposes. Always, and I mean always, talk to your doctor before starting or changing how you take any medication. They can provide personalized advice based on your specific health needs. I hope you found this video helpful. If it sheds some light on your situation, please give it a thumbs up and consider subscribing for more content on men's health. And feel free to share your thoughts in the comments below. Thank you for watching, and I'll see you in the next video.